Hi, everybody. This is Marketa Houskova. I am the Executive Director of American Nurses Association California, and I am here joined by our lobbyist extraordinaire, Roxanne Gould. Hi, Roxanne.
Hi.
And we are here to give you exciting update on the 2021 legislative session. So before we get into the nitty gritty of the fate of the bills that we've been following, first tell us, so where are we at the legislative session right now, Roxanne?
Okay, so the legislature operates in 2-year sessions, and we are at the end of the first year of a 2-year session. So it means bills can be introduced in 2021, and they may not pass a deadline, so they'll fail, or if they pass a deadline, they could be called what is a 2-year bill, which means when the legislature reconvenes in January, they will have an opportunity to consider that bill and determine whether or not they want to move it forward.
So, okay, so we are done with the first portion, right, with the 2021. And since this is not a election year, that means that the same people are coming back starting, I guess, December, kind of January 2022, and then they will have new opportunities to introduce bills for 2022, correct?
Right. What will happen in January are a few things. So they'll start with having the governor present his budget proposal. They'll be focusing on the 2-year bills, because if you're a 2-year bill, you have to be out by the end of January, but if you're going to pass out of your house of origin. And so they'll focus on those 2 items primarily, but bills will begin to be introduced, even potentially on the first day of session. But the highest priorities and maybe the highest profile, potentially most contentious bills, those are likely to be introduced right away, because they want to hit the ground running and start to pave the path for those measures.
Right. And I would be remiss not to ask you, since this is a second week in September, and I would be remiss if I didn't ask you about the recall. So what is the fallout? Or so we know that Governor Newsom did not get recalled. So what is the fallout? What is the fate of California Republicans? And again, we talked about it a little bit before this recording. So ANAC is a bipartisan organization. So we work with both sides of the aisle, but this is really a very interesting issue, and especially, kind of when you kind of look at the state of California Republicans.
And I'm bipartisan. I've just seen from the beginning of my career, I've just seen the Republican Party get further and further away from California Republicans, and that's what happened in this election. The lay of the land was Californians were fed up, frustrated, terrified because of COVID, the impact on their personal lives, impact on their jobs, impact on businesses. They're being threatened with wildfires. They're being told we're having droughts and, slow down your water consumption. There are so many things that the voters were just so fed up about that's why the recall election was put on the ballot. And that's why the surveys early on said the governor was really in danger. The problem is first of all, there were too many people that were the second choice, but the highest profile and the candidate that was raising the most money was too far right for even California Republicans, let alone Democrats that were fed up with the governor. And it's just they're out of touch with what California Republicans, which I would say are different than Republicans in other states, with what they were willing to accept. And as a result, the governor won handily. He won even stronger than I think most polls estimated, even at the end.
Yeah, 2-1. Yeah. And so what is the fate of California Republicans, like the Republicans that are elected in California State Assembly and in California State Senate? So
right.
So what kind of a power, do they have any power move left, or, well, they don't?
Well, nothing has really changed, because the Democrats have a supermajority in both houses. Every constitutional office is held by a Democrat. The value Republicans could have to offer is if they would become more moderate and bond or negotiate and coordinate with moderate Democrats. That happened back in the day. We had something called the Gang of Five, and it was 5 Democratic legislators that were moderate, and they didn't like how left-leaning the Democratic proposals were. So they negotiated and bonded with the Republicans to try to have more moderate legislative proposals going forward. And I saw an email this morning from a very conservative Republican Assembly member who basically said, Republicans in California aren't getting it. We need to look at what Republicans in California want and give them policy options that are in their wheelhouse, things they're comfortable with. And his whole tenor was Republicans are out of touch with the electorate. And if we don't find our way to touch them on the policy issues that matter to them, we're not going anywhere in California, was his basic
Mm.
message.
And I think that, this recall, and the result of it, I think it speaks very loudly to, the out of touchness
Mhm.
of Republicans in California. And I
Mhm.
know that I've attended several of their conventions and several of their meetings, as I attended several of the Democratic meetings, and I think they are split because, like half of them, they really want to be Ronald Reagan's Republicans, and then half of them want to be really conservative Republicans, way more than Ronald Reagan ever was. And I think
Right,
that they have this internal struggle there. But I think it's the same for the Democrats, right? They're also
right,
kind of very left leaning, and then the moderates.
right. And that's where the opportunity is, I think, for the moderate Democrats and moderate Republicans, because California is more left than most of the rest of the
Right.
United States.
Yeah.
But that said, a number of the Democrats would be Republicans if the Republican policies would become more moderate, but instead they don't align themselves with the extreme policies. Therefore, they find themselves clicking the Democratic box just because they can't identify with Republicans, even though naturally they would.
Yeah. I think that has been the California GOP's fall from grace for last several years, because they just cannot the brand of republicanism. Some of them want to advance. It's not necessarily the one that California Republicans are searching for.
Right.
And even though they did make a massive change, was it 2-3 years ago that there is the different chairman, Jessica somebody? I forgot her name, right? There is this new chairwoman or the leader of the Republican Party, and it's a Hispanic woman. And I thought that was a great way to really bring California Republicans a little bit out of the right wing to conservatism. But
I'm not certain that California Republicans in the legislature really defer to the Republican leadership in the party. They'll go to their it's called a party conventions. They'll vote in the platforms for the party, but I've not heard a single legislator, Democrat or Republican, say, this is in sync with the Democratic Party platform. They, in theory, they should be putting forward what is in sync with their district's needs, and irrespective of whether that's in sync with the party platform.
Right. No, that's very true. And the reason, for those of you who are listening and watching us, the reason we are discussing this, because the recall was a massive, several months, massive effort. Is it like $300 million it cost?
At least.
And so that is a major political development, and now major political event. And so that's why we are covering a little bit more. And plus, let's just reiterate that we are 501c6, which is a lobbyist organization, and we do operate inside the political and policy arena. So that's why we're covering issues of politics, policy, and regulation. So now we've covered all, these two important aspects. So
one thing, Marketa, that's important to note is that the pollsters are saying, because the results were so strong for the governor, that it's basically clinching his reelection. So it was a question of whether or not he was going to be recalled. Then if it was really close, it was going to empower the Republican that got to take over for him. But since it didn't happen, it was so much in support of him that it's basically a guarantee that he will be reelected unless he makes some major stumble. And I've seen some major stumbles that haven't impacted people's ability to get reelected. So we'll see.
Sadly, very true. Yeah, absolutely. And so now we've covered this. So let's cover some of the, I think I have 8 or 9 bills on the list. What we've been the priority bills that we as ANAC we've been watching, supporting, opposing, monitoring, and giving you regular updates ever since the start of 2021. And so the first one, let's start with AB 285, and that's the school nurse consultant bill. That, quite frankly, I really did not think that it would be this complicated and this controversial and this problematic. We're talking about creating a one position at the huge California Department of Education, which is a huge department. And it doesn't have one school nurse who would actually be part of the planning and implementation team.
Right.
So if I remember correctly, that proposal, that bill didn't even make it out of the first committee. I mean, what the heck is going on?
And if it can't happen in an era of COVID, maybe kids weren't in school, but then they were starting to have distance learning with a combination and hybrid. But we need school nurses in schools. They will be going back to school. And if COVID doesn't shine a bright light on that, what will?
Yeah. So that's AB 285. But what really got me, and I talked about it yesterday with Jared at our office, it is AB 562. And that's Evan Lowe's bill. That's the mental health support for frontline healthcare providers providing care during COVID-19. And that stated that all the Department of Consumer Affairs, all the boards would have to provide mental health programs and support for frontline healthcare providers. The fact that it was held in committee, it's not even a 2-year bill, it was held in committee, so it died. And so that really got me very upset, because I thought that for past 18 months, I kind of stopped counting, but for past 18 months, we as nurses and physicians and physician assistants and respiratory therapists and physical therapists and LVNs and all our colleagues, physicians, a lot has been asked of us, and we've accepted it, and we went out there every day. Absolutely. And we did, and we do our best. What we need is this help and this support, because majority of nurses, they have moral injury, they're exhausted, burned out, tired. Everybody wants to retire. We don't have experienced nurses. COVID exacerbated nursing shortage. Not that we don't have enough nurses. We can have plenty of new grads, but we don't have experienced nurses. And so when we need help, we don't get it, right? So AB 562,
in an
what
era
is going on?
They're shining a bright light on this surge in suicides and suicide attempts. I mean, I don't remember if it was it Denver or Colorado, mayor or governor declared a state of emergency because the number of teens that were being sent to the ER because of attempted suicide, and not just teens. I mean, depression is rampant, and that's for people that are just dealing with COVID personally, not having it, but experiencing everything around. What about healthcare workers? How is that not exponentially more needed to have mental health care? It's just stunning.
Yeah, and and we will have later this year or early next year, we are very lucky to be working with Dr. Danisha Jenkins that worked with UCI, Dr. Candice Burton, and they were working on a research survey in terms of moral injury and nursing suicides. And so now they've compiled the data, and the data is awful. And it's alarming, and it's very problematic. And so Danisha, now Dr. Jenkins, is kind enough to do a webinar for us, for ANAC members. And so we will be talking about this. So we know the issue, we know the problem, we know how hard we as nurses and nursing profession we were, and yet we don't get the support, we don't get the help we need. I'm having difficulties just kind of accepting that in my mind. And I know it's politics, and I know it's about money and all of that. It's just, that just doesn't compute in my mind.
Yeah, it's stunning. I mean, I guess the only place someone potentially could say the reason I didn't vote for that is because, we cherish our frontline workers, but they have health care. They have access to mental health. So why do we want to allocate budget funds for something that they already have access to? That could be the only thing somebody could say with a straight face, potentially, because nobody can argue that it's not necessary.
Right. And actually, speaking of which, on September 28th, if I remember correctly, we are hosting, Dr. Dan Weberg is hosting a mental health panel discussion with Dr. Bonnie Clipper, with Dr. Benedict Melnick, Dr. Anita Girard, Dr. Jim D'Alfonso, and with our ANAC fellow, Carolyn Duenas. And so we will be talking about this very issue. What are the barriers to nurses getting access to mental health resources? What other organizations such as Cedar Sinai or Kaiser Permanente or WAMBI, where Dr. Bonnie Clipper works for WAMBI, and of course, Dr. Benedict Melnick, they've developed mental health resources for nurses. And so that's something that we're really looking forward to be discussing, but that is still not taking away from the fact that here in California, that the state did not deem important or necessary to give us the support we need. So that's AB 562. Next, AB 1407, that's Autumn Burke's bill, and that's the implicit bias training and for all nurses, and that it has to be part of all all CE courses, which actually, for ANAC, we do talk about because it is the racism, and it is, microaggression, and it is diversity and equality and inclusion. So we do talk about social justice and access and health equity. We do talk about it in all our courses and in all our events. But that is now that is at the governor's desk. So let's see what he's going to do about that. We have another one. It's AB 410, and that's the e-compact bill. Roxanne, is that a 2-year bill?
Yes, that's a 2-year bill.
Okay.
Which, as you described, it means it has until the end of January to advance, but it means they didn't deem the policy not worthy to be continued. So that's a good sign, I guess.
Okay. So what does it mean when you say that they have until end of January to act on it? So what does it have to happen in order for the bill to move along?
My mind is a little foggy from the end of session. We just ended, and so I've got smoke coming out of my ears. But if a bill has made it past certain deadlines, it becomes a 2-year bill, but it has to be out of its house of origin by the end of January in order to be able to advance to the other house.
Okay, so there needs to be a vote, and it needs to pass, and it needs to get out of the house of origin, and then it can survive.
Right.
Speaking of 2-year bill, AB 852, which is Jim Wood's cleanup bill to AB 890, it also is a 2-year bill, which is somewhat surprising. Actually, it should not be surprising because 890 was also a 2-year bill, right? So if he wants to clean it up, so AB 852, it's also a 2-year bill. But what another bill that is on governor's desk is AB 1532, and that's the BRN sunset bill. And so the language of that bill states that the BRN will get 1 more year to work under the same guidelines as it has, and until January 2023, and then it's going to come up for sunset again. So, I mean, the governor, he has to sign it, right? So he's not going to sign it, and we're going to close it down, or?
No, I think he'll sign it, of course. I mean, most of the debate negotiations take place when the bills are being drafted and negotiated and heard in committee. And an interesting thing to note is if the governor had been recalled, he still would have had an opportunity to act on every bill on his desk, because typically, for example, when Governor Davis was recalled and Governor Schwarzenegger,
2003,
it took about 45, 48 days for Governor Schwarzenegger to be sworn in. So that means, Gray Davis was what is known as called a lame duck, meaning he knows he's out of there in a certain amount of time. But Governor Newsom would have still had the ability to act on every single bill on his desk, because there were some that were concerned, he better hurry and sign whatever needs to be signed by September 14th, or we might lose our bill because a Republican might be in there. That was never a threat.
Yeah, that's a very good point. But one bill that we were supporting that actually made it to the governor's desk is SB, right? Senate Bill 380, and that's the End of Life Act, because you know that we've been supporting the previous iteration of the bill in 2015, then it was enacted in 2016, 2017, and it was a pilot program. So now they're just trying to get the bill signed. So now it becomes a law. And also, if I remember correctly, some of the very convoluted steps that patients must take in order to be given the prescription for the end of life medication, that it's not this many steps, but only this many steps. So that's on the governor's desk, correct?
Right, and it's in sync with his policy. So I don't see him having a problem with it. I see him signing it. And if a bill gets to his desk and he doesn't sign it and he doesn't veto it, it becomes law anyway. On its own.
Yeah, so that's that. And then another kind of interesting bill is AB 1015, and that's Blanca Rubio's, I think it's Rubio's bill. And that's the one actually we met with Rubio staff on this bill several times with our coalition partner, Health Impact. And that's the one stating that the BRN must be using regional data for decision-making in terms of nursing education and the future of nursing practice. And so that also, actually surprisingly, made it to the governor's desk.
Well, and it makes sense.
It makes sense.
Has so many different ecosystems. We're like several countries all on our own. So why would you want to compare something that is in Los Angeles to, Humboldt? We're just so different. So you should be using data that is regionally specific, because that's the data that's relevant and accurate.
Right.
Not apples and oranges being compared.
Absolutely, absolutely. So that's 1015. And then last but certainly not least, it's our favorite AB 1400, and that's the single payer bill. So that's a 2-year bill. So so then the governor has no governor, the legislature, right? So they have until end of January, 2022, to get it out of the assembly into the Senate in order to stay viable, correct?
Yes. And I mean, it's such a controversial issue because I mean, we were so flush with money this year and got so much money from the federal government, yet they still didn't see it, deem it fit to pass. But the concept is something I don't know that anybody disagrees with. It's just how much does it cost and how are you going to pay for it? And so maybe they'll continue to negotiate on it through the fall. But I think history has shown us that they just can't find middle ground. It's one side says, so what? It costs so much. We need this. And the other side says, well, we don't have a bunch of blank checks to spend. We need to be fiscally responsible. So it's unless it gets seriously amended, I don't know that I see it moving.
And plus also there is always the issue of, what is universal healthcare coverage versus single payer. So, right. So we are obviously all supporting universal healthcare coverage. So every Californian has access to healthcare coverage and health insurance. But that is not to say that single payer people, that's like DMV, right? That's single payer, that's government, like government giving and offering healthcare, paying itself or not paying itself, because then they're going to increase our taxes. And so, when I think that I would have to go for my mammogram to DMV, right? It's like, I don't even know, like last time I was at the DMV, I really try not to go there, but that's portal to hell. And so, so we all know, we all know how hard that is, right? So if this is the way California healthcare will go, that's obviously something that that's something that the legislators really need to discuss, if there is a better option. But so far nobody can find it.
Right. It's just highly contentious and politicized, that oftentimes even good information and good facts and good details get lost in all the heat of the fight.
Okay, I think this is the time where I should I should say that I apologize to all DMV employees. It's nothing against you. It's just simply the fact that government is responsible for huge, large bureaucracy and system.
Bureaucracy, exactly. And they're working there, but they're working there within the confines of the bureaucracy created. Exactly. Absolutely.
So it's the staff is it's very difficult for them to change something because they cannot, because they are working within the confines of the system. So it's the system that I'm criticizing. All right, so I think we covered all the bills. Any last parting thoughts? Or so you and we're gonna meet again and we're gonna do another exciting recording once the deadline for Governor Newsom to sign, veto, or not do anything has passed. Once we know what happened, we're gonna bring you another Ledge update, correct?
Absolutely. Bring your popcorn.
Bring your popcorn. We deliver a good show. So, and with that, I would like to thank all of you for listening to us and watching us. I would like to thank Roxanne for her time and expertise and for always being a good sport. And I think that's it, right?
Well, and thank you for your leadership, Marketa.
Oh, my pleasure. What can I say? No, it's a pleasure and honor to be part of this team and lead this organization. And so, I love what I do, and I am at the right place at the right time.
And so thank you for being the #1 most trusted profession.
Yay! All right. So thank you, everybody. Bye. We'll be back. Bye.